Welcome to the Essentra Health podcast series. I'm your host, Yeji Lee. In this series, we bring you helpful information to support your well-being and to overcome the many challenges that life can bring. Our aim always is to bring you information or actions to support our well-being that are accessible to everybody. Today, we will be discussing the value of employee assistance programs for employers and the distinct relation between EAP services and mental health. Our guest today is Norman Weiniger, Vice President of Clinical Services at Essentra Health and licensed mental health practitioner with many years of experience working in the mental health field.
Thank you, Yeji, and so happy that we're able to talk today about the relationship between EAP services and the support of mental health.
Yeah, thanks for being here today, Norman. To start us off, can you speak a little bit about how you would describe what an employee assistance program is all about?
Sure. Essentially, an employee assistance program, or an EAP, is a confidential employer-sponsored program that provides a wide variety of services that assist employees and their families with most any personal issue that could affect their well-being or even their job performance. So services include personal counseling services that are delivered in person or virtually or in the moment support. It's basically EAP counselors are standing by 24/7 to speak with participants because we know that sometimes that is what people need to find a solution for an immediate personal issue or to get some in the moment guidance about human behavior. That's why the EAP provides that particular type of support. The EAP provides so much more, though. It also provides services around consultation with attorneys about legal concerns, free consultations with financial professionals around concerns about money matters or about childcare or elder care issues. It provides all of those kinds of services, Yeji, because those are issues that are also affect our well-being and can create distractions at work, but pertain to professions other than counselors. Too often, EPs are thought of as counseling only, but they provide a wide array of services, all aimed at supporting well-being.
Thanks, Norman. It's definitely a wide variety of services that you just mentioned there. I want to ask, why is it that employers invest in employee assistance programs?
Great question. Why do they do that? I think it's because employers recognize that life today is not getting any simpler. It's not getting any less stressful. It's, if anything, getting more complex. Employers know that life can bring all sorts of challenges to us at any point in our lives, and they recognize it's smart business for employers to support employees' well-being. They know that sometimes these sensitive personal issues, for example, like marital concerns or family issues or managing personal stress, these are common reasons that people contact their EAP. They can reach the level of creating a distraction. It can even impact one's job or one's career. So they invest because they want their services to be easily accessible and to help employees with most any personal issue before those issues reach the level of affecting their well-being or potentially their job performance or their conduct at work. They also structure programs, Yeji, to provide services to assist managers in supporting their team, therefore helping managers and supervisors. They provide a lot of services that proactively build resilience and resiliency skills in employees through education services that they offer. And very importantly, they help work groups recover from traumatic events that they might experience as a part of their job. I would call out that employers want their EAPs to provide a variety of what you can sometimes hear called work-life balance services aimed at assisting people with everyday non-counseling issues, like I mentioned a moment ago. So they want an array of services to invest in because they understand that lots of different issues can come up over the course of people's lives, and they want the EAP to be a good solution, or at least a good starting point. A lot of employers think of EAPs, YEGI, as wellness programs. Because they're basically preventative in nature, and by that I mean that their services not only help build personal resiliency, help people manage stress through educational programs or one-to-ones, but they also help them with issues around legal issues, finances, most any kind of program that can, most any kind of issue that can affect people's well-being. And we, as you know, YEGI, and I think employers want this as well, is for us to emphasize for people to use these services, make them easy to use early on before problems escalate. Many times, these programs can also help people who might have the early stages of a more significant issue to identify that and to help those people get into the proper resources to address that type of issues. So employers invest in these programs because they understand that personal issues can impact well-being, which in turn can impact productivity at work. So key points and all that, Yeji. Employers want programs to be confidential, to be a no-cost means to a solution. They understand that by doing that they can help improve the workplace's productivity and reduce risks for the work organization. They want the employees also to have access to services such as an EAP during a workplace emergency. And they want to add the EAP to their complement of services that they provide to their employees to support their functioning in the workplace.
Thanks, Norman. Kind of staying on topic of employers, why do you think employers value EAP so much? And I guess, can you speak to what, some of their positive impacts are?
Yeah, I I think the fact that these programs are very common in this country and really internationally says something about how much employers value EAPs and how commonly they fit into a group of supportive programs that they offer. Uh, in terms of impact, um, over 80% of the people who use these programs services say that it helped them with the issue that they sought help for, and nearly that many say that it helped them to be more effective in their work. And employers especially value that result as a very positive impact of the programs. In another sense, EAPs can function as a type of hotline because they are 24/7. They are staffed by counselors. So very concretely, they do save lives. For example, our EAP service assists hundreds of people every year who are in some type of a crisis, maybe a suicidal type of emergency, or an emergency around domestic violence, or struggling with substance abuse. So while EAPs are not 911 or 988 services, they are capable those kinds of potentially life-saving types of interventions, and that's obviously extremely impactful and positive.
Um, yeah, I think, Norman, you and I are both licensed mental health professionals, and we both are able to recognize the relationship between good mental health and the satisfaction and success in one's work and their personal life. So, can you talk some about the relationship between mental health and EAP services?
Yes, you made me think of how there's uh, research that shows that poor mental health is a leading cause worldwide of lost workdays, of lost productivity, of absenteeism, of workplace accidents. In fact, I read something recently that mental health conditions are the second leading cause of disability in the United States. So EAPs are important in that sense that they provide a proactive and a structured response to these mental health challenges, which um, come to the workplace with employees, and that they provide services that benefit both the employees and their and the employer. One core purpose of EAP centers around helping employees cope with psychological and emotional challenges that might otherwise interfere with their personal well-being and therefore with their work life. So, how do they do that? Well, we provide services that are confidential and professional. You make them free of charge, and all that helps to employees to seek the assistance. And you are constantly working on reducing stigma around reaching out for help and reaching out for those kinds of services. The another important aspect is EAP's focus on early intervention. Let's help people with services before they escalate, before they start to impact people's mental health or their well-being. EAPs also relate to mental health in the sense that they provide very important support for workplace-related stressors that are affecting well-being, be it the stress of the everyday job or something extraordinary such as a traumatic event that suddenly happens in the workplace, or somewhat slower traumatic events such as reductions in the workforce that are happening in some places these days. Um, Another issue around that point is that most of the people who have the most common mental health conditions, and those would be conditions around anxiety or mood conditions, as well as people, yet you hear in recovery from substance misuse issues, are employed. They are in the workforce and they do very well most of the time, but they occasionally may need a little professional assistance in managing their conditions, and that's where the EAPs can come in to help them with that. And finally, I would just say that EAPs support mental health and well-being through the educational and consultative aspects that are aimed at building resilience, helping people build their coping skills, and support the workplace overall in that way. And I think that's another very important aspect of what EAPs can do to support mental health.
Yeah, thank you so much, Norman. I think you shed a lot of important information today on just EAP in general, its details on its services, as well as its relationship to mental health. And I hope that everybody that listened in learned a lot today. And I know we both encourage people in need to access their EAP or simply just contact their EAP to learn more about it. And so, with that, we conclude today's podcast. And on behalf of everyone here at Essentra Health, thank you for listening.